My question is, with all of the things that need to be done, where do you begin to turn the tide back? And how do you do it in the first term?
Yeah. The question was, with all the things that need to be done, where do you begin to turn the tide back? I think you have to set priorities. There are hundreds of things that need to be done. And my view is the priorities, at least my priorities, I'll tell you what mine are. My priorities are health care, universal health care. I think our health care system is so dysfunctional, and it's destroying the lives of millions of
But
Americans.
can I interrupt?
Yes, ma'am, of course you can.
How do you get the insurance companies to back off from running healthcare?
All right, let me talk about that then. Look, I told you my priorities. She had a follow-up question, which was, but I didn't get far into the answer. That's good, though. You didn't want to hear a long-winded answer. My priorities, and then her second question was, how do you get the insurance companies to back off so they're not running health care? Priorities, health care, energy/global warming, creating a more equal playing field so that not just rich people are doing well, that everybody gets a real chance, and restoring America as a force for good in the world. Those are the four biggest priorities. Now, health care. Here's what I tell you exactly. I tell you very exactly what I would do. The first day in office, I would bring over the leadership in the House and the Senate, Republican and Democratic, and I would say to them, here's my universal health care plan. But I say to you all right now, nobody made me the God of health care knowledge. You know, the only requirement I have is that it be universal. If you want to argue about that, we have nothing to discuss, because I will have universal health care in this country. If they want to talk, but if they have different ideas about how to do it, what the process should be, you know, those kinds of things, I'm wide open to that. Wide open to that. Then I would walk out on the White House lawn, and I would say to America, I wasn't just talking a few minutes ago when I said the real power is in the country. I would walk out and say to America, we need universal health care, here's why, and here's what I'm proposing we do. And then I would say, now let me warn you right now what's going to happen. It's going to probably start tomorrow. You're going to see millions of dollars spent on television, on radio, in newspapers to defeat this universal health care plan. Every time you see one of those ads, you ask yourself one question. Who's paying for this? Because I'm going to tell you in advance who's paying for it. The people who are charging you billions of dollars for your health care. That's who's paying for it. They have a lot of money invested in they can continue to charge you whatever they want. Drug companies, when you go to the pharmacy to pay for your medicine, they don't want universal health care. They want to keep having you pay through the nose for the medicine that keeps you alive. You know, sooner or later, we, America, we're going to have to stand up to these people. I'm willing to stand up with them. I've stepped up to them. And I need you to stand with me. Are you willing to stand with me? Are you willing to stand with me to have universal health care in this country? Because we need you.